From the JAMA Network, this is JAMA Psychiatry Author Interviews. Conversations with authors exploring the latest clinical research, reviews, and opinions featured in JAMA Psychiatry.
Welcome to the JAMA Psychiatry Author Interview Podcast. I'm your host and web editor, Dr. John Torous. Today we're thrilled to be discussing a new paper just out in JAMA Psychiatry on the association of COVID-19 with mental illness in vaccinated and unvaccinated people, a population-based cohort study in OpenSAFELY. We're about to be joined by the corresponding author of the paper, Dr. Jonathan Sterne, PhD, from the National Institute for Health and Care Research, Bristol Biomedical Research Centre in Bristol, UK. While we all hope that the worst of the COVID-19 pandemic is behind us, we know that the virus is not gone. And for many people who are infected with COVID-19, there has been concern that the infection is associated with new onset of various mental health conditions. But what do we know about this link between COVID-19 and the incidence of new mental health diagnosis? And how does COVID-19 vaccination status impact that risk? To find out, we'll explore the results of a brand new study looking at this question with data from 18 million people just out in JAMA Psychiatry. Dr. Sterne, thank you so much for joining us. And to jump right in, before you and your team did this research, what did we know about the association of COVID-19 and developing a mental illness?
Well, thank you very much for the opportunity to talk about our paper. Before this study, a number of papers had looked at associations of COVID-19 diagnosis with mental ill health. And broadly speaking, they had reported associations of different magnitudes. Some studies were restricted to patients who were hospitalized with COVID-19, some not. The duration of follow-up varied. And importantly, the nature of COVID-19, as we all know, changed profoundly as vaccination became available. And there was little data on the impact of vaccination on associations of COVID-19 with subsequent mental ill health. So we set out to clarify the timeline for associations of COVID-19 with mental ill health, to look at the impact of vaccination, and given that a very large data set was available to us, to look at different mental health conditions subsequent to a diagnosis of COVID-19.
So we knew that there was definitely an association, and as you said, there were a lot of unknown factors. What were the biggest remaining questions that you and the research team wanted to answer about COVID-19 and mental health? And I think you alluded to some of those remaining questions.
That's right. The big questions that we wanted to answer were, what were the associations with different mental health conditions? What was the timeline, and were there long-term effects or were these short-term effects? And very importantly, what was the impact of vaccination on these relationships?
Yeah, so all very important questions that we need to have answers for. And to begin to get those answers, you use something called OpenSAFELY, which is a secure analytics platform for the National Health Service in the UK electronic health records. How many records does OpenSAFELY have, and what date ranges were you pulling from, and what is just the size and scope of OpenSAFELY for those of us who may not know about it?
OpenSAFELY was created very rapidly at the beginning of the pandemic, so in the first half of 2020. And it contains data, or it pulls data on essentially the whole of the population of England. The way it works is that NHS patients, National Health Service patients in England, are all registered with a primary care provider. We call them general practices. And in England, these general practices, almost all of them use one of two electronic health record providers. And OpenSAFELY is built inside the cloud storage for these two electronic health record providers, one of which is called TPP and the other of which is called EMIS. And by operating inside their cloud data stores, it provides a secure way to access data on close to the whole population of England without having to move the data with all the attendant risks of violation of privacy protection. It also enables linkage of these primary care data with secondary care data, data from hospitals, and information on admissions to hospital and information on COVID-19 vaccination, and linkage to information on deaths and causes of death from the UK Office of National Statistics. The data that we analysed were from OpenSAFELY TPP, which contains information on up to about 18 million or 20 million adults registered with primary care practices that use one of these two software providers.
Thank you for telling us about OpenSAFELY. That sounds like a massive data set. Using OpenSAFELY, which mental health conditions did you and the team search for, and how were you able to identify in OpenSAFELY in these medical records who had those conditions?
Well, our paper mainly focuses on two conditions, which are the most common classifications of mental ill health, and that's depression and serious mental illness. Serious mental illness is a composite of schizophrenia, schizoaffective disorder, bipolar disorder, and psychotic depression. So in addition to those two general diagnoses of depression and serious mental illness, we also examined general anxiety disorders, post-traumatic stress disorder or PTSD, eating disorders, addiction, self-harm, and suicide.
With these different disorders that you and the team are looking at, as you mentioned, you also want to determine if someone was hospitalized with COVID-19 or not. Was that data easily available in the system?
COVID-19, as you well know, hit the world very suddenly. So in the first stages of the pandemic, widespread population-based testing was not available in the UK. So in the earliest part of the pandemic, diagnoses are based on electronic health records rather than on testing. In the UK, widespread testing was available by October 2020, and those testing data are all linked within the OpenSAFELY dataset. So after about October 2020, we rely substantially on positive tests for SARS-CoV-2 in informing our classification of people diagnosed with COVID-19. We additionally use other information such as diagnoses from electronic health records, and we look for the first diagnosis through any of a number of criteria. Similarly, for mental health conditions, we are recording outcomes using primary care diagnoses, hospital admissions based on ICD-10 codes, or death with an ICD-10 code as the primary or underlying cause. And that's an ICD-10 code for one of the mental health conditions we studied.
So now that you've helped us understand, OpenSAFELY gives you access to all of this data. You're able to identify who had a vaccine, who didn't, who had COVID, who was hospitalized. In the paper, you note that the pre-vaccine availability cohort included 18.6 million people, of whom just over 1 million had COVID-19. These are vast numbers that you and the team were able to bring. What else can you tell us about people that ended up in these samples that are in the millions that you're going to have results on?
They are essentially the whole of the population, adults, and registered with one of these primary care practices. So all ages, not selected in any way. We expect that the results will be generalizable to other healthcare settings and systems because there's no selection going on at all, apart from the fact that it's people whose primary care practice happens to use one of the two software systems that are used by primary care practices in England.
You report that the incidence of mental illness was higher after COVID-19 or when people contracted it than before or without. Can you tell us more about this important result?
At the beginning of the pandemic, of course, nobody had had COVID-19. So we followed up the whole of the population that I've described. In the cohort that was followed before vaccines became available, we followed people up from the beginning of the pandemic. And then for people who at some point were diagnosed with COVID-19, we split their follow-up into a time period before they had COVID-19 and a time period after they had COVID-19. And we compared the incidence of mental illness, that is, how fast new diagnoses of mental illness were recorded over time, before or in the absence of COVID-19 diagnosis. We compared that with the incidence after a diagnosis of COVID-19. As you say, the broad pattern was that incidence was higher after COVID-19. And we also looked at how the elevation in incidence with time since a diagnosis of COVID-19.
As you said, you broke it up into depression and serious mental illness, but let's talk about what you found for depression first.
As well as the pre-vaccine availability cohort, we created two further cohorts, one vaccinated cohort who were followed from the time that they were vaccinated. In the UK, as in many countries, vaccination was rolled out according to risk. So vaccination was first offered to the oldest people in society and to people such as healthcare workers. And then it was progressively made available to younger individuals. In the vaccinated cohort, we followed people from the time that they were vaccinated. And in the unvaccinated cohort, we followed them from 12 weeks after vaccination became available. So these were people to whom vaccination had been made available, but who had not been vaccinated. So for all of those three cohorts, we looked at the incidence of depression with increasing time since diagnosis of COVID-19. The incidence was higher in the first weeks after a diagnosis of COVID-19 in both the pre-vaccine availability cohort and in the unvaccinated cohort. But there was only a very small increase in incidence in the vaccinated cohort. When we split the follow-up into follow-up after hospitalized COVID-19, so people who had severe COVID-19, and follow-up after COVID-19 for which people weren't hospitalized, we found that the patterns looked quite similar in the three cohorts. So the elevation in incidence of depression after COVID-19 was mainly in people who had COVID-19 that was severe enough for them to be hospitalized. And in those individuals, the elevation in incidence, which was 16-fold soon after COVID-19, was similar regardless of which of the three cohorts participants were followed up in. Now, vaccination protects against severe COVID-19, so that says that the protection that vaccination provides against mental illness after COVID-19 is attributable to it preventing severe COVID-19.
And how do these results compare for the cohort with serious mental illness?
Well, the patterns look pretty similar. So broadly speaking, soon after COVID-19, there's an 8-fold increase after hospitalized COVID-19, but no evidence of an increase after non-hospitalized COVID-19. For both depression and serious mental illness, we've got longer follow-up in the cohort that were followed before vaccine became available, because of course that was longer ago in time. And in those individuals, by the time that we get to beyond the first year of follow-up, there is still a modest elevation in the incidence of depression in the second year after COVID-19, but that we don't see that for serious mental illness.
For Dr. Sterne, what else would you want to cover, have listeners know in these important results around COVID, vaccines, and incidence of new mental illness?
So we did some analyses in which we stratified according to prior diagnoses. And in those analyses, we found that the elevation in incidence, and this may be a little counterintuitive, the elevation in incidence was mainly in those with no prior history of the event rather than in those with a prior history. So, for example, for depression, the long-term elevation in incidence was seen in those with no prior history of depression, but not further events in those who already had a diagnosis. That was also true for serious mental illness. And then if we looked at the other mental illnesses, we found modest elevations in incidence soon after COVID-19 for general anxiety, for then even smaller elevation in incidence soon after COVID-19 for PTSD and eating disorders, but no sustained elevation in incidence for those disorders or for addiction or self-harm or suicide.
I encourage everyone to read so many of the exciting, important details in the paper, which is linked in the episode's description. My next question is, overall, what do these results tell us about the impact of vaccines for people that we treat and work with, for people at risk of mental illness or who have mental illnesses?
I think unambiguously, the message of the paper is that where vaccination first became available, then it had profound benefits beyond the established benefits in preventing severe COVID-19. Those benefits transferred, so that implied that providing you didn't get hospitalized with COVID-19, the elevation in depression and serious mental illness was limited. And so the benefit of vaccination was that it prevented people from getting severe COVID-19 and therefore prevented the adverse consequences of COVID-19 in the longer term by preventing hospitalization and severe COVID-19.
This isn't a paper on long COVID, and we haven't talked about long COVID in our discussion. For those people who may be experiencing ongoing symptoms that could be related to long COVID, how can these results help us understand why that condition perhaps has impacted so many people?
Well, that's a difficult question. And as you say, the one that isn't really addressed in our paper. And this is really beyond what's written in the paper. But it was well established before the pandemic that getting a severe respiratory illness, and in particular being hospitalized after a severe respiratory illness, is associated with long-term consequences. And that is clearly true after COVID-19, as it remains for other respiratory illnesses. It's clear that diagnoses of COVID-19, particularly early in the pandemic, were associated with the range of symptoms that are considered characteristic of long COVID. I think it's pretty clear that the effect of COVID-19 on these long-term outcomes has been ameliorated by vaccination, and that's consistent with the results of our paper. But I'd just emphasize that our paper does not look at long COVID, and so in giving those opinions, I'm not really speaking about the results of our paper.
Understood that question was outside the scope of this paper. Maybe perhaps a question that's more in scope. What do you think the public health implications are of these important results, or what would you want policymakers listening to this podcast to be aware of?
I guess two things: that there are long-term consequences of COVID-19, particularly COVID-19 that was severe enough to lead to hospitalization, and that we should be concerned about continuing consequences in people who experienced severe COVID-19 early in the pandemic, and they may include a continuing higher incidence of mental ill health, such as depression and serious mental illness. And the second issue relates to vaccination. I think there are a lot of questions now about the benefits of ongoing booster vaccination in populations that are already highly vaccinated and highly exposed to prior COVID-19, but that people who are advised that they are under-vaccinated or in whom it is recommended that a further vaccination is received should take those invitations seriously, because by preventing severe COVID-19, which is what vaccination does, you can prevent consequences such as mental illness.
I think we all hope there is not another pandemic, but if there are flare-ups or more issues, what do you think the main lesson that we can learn from your work to perhaps be prepared for next time? And you may have answered this already.
Well, the UK has an ongoing inquiry which is going to make lots and lots of recommendations for what mistakes were made last time and how we can be better prepared next time. But maybe I could just focus on the role of rapidly linked electronic health records and their availability for urgent analyses. I think a fantastic job was done because of the existence of the National Health Service, which is a single service that serves most of the population in England and the wider UK. Detailed electronic health record data were available in principle, but had not been made available for research before the pandemic happened. These secure data platforms were rapidly developed, and I think a big lesson for the future in England, in the UK, and in other jurisdictions is that by making data rapidly available and conducting analyses rapidly, you can gain extremely important insights that can be used to help with public health emergencies when they arise. We all hope, of course, that another emergency won't arise for many years.
I think that's very sage advice on getting the right systems in place that would certainly apply, at least here in the US where I am. So thank you again. I'm John Torous. I've been speaking with Dr. Sterne about the associations of COVID-19 with mental illness in vaccinated and unvaccinated people, a population-based cohort study in OpenSAFELY. You can find a link to the article in this episode's description. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for JAMA Network wherever you get your podcasts. This episode was produced by Shelley Steffens at JAMA Network. Thanks for listening.